Today, we're going to be presenting on our research on occupational accessibility in rural homeless populations. Individuals experiencing homelessness in rural communities are at an increased risk of occupational deprivation secondary to limited access to transition, healthcare, and leisure resources, thus contributing to decreased engagement in meaningful occupations. Occupational deprivation is defined as a state of preclusion from engagement in occupations of necessity and/or meaning due to factors that stand outside the immediate control of the individual. There is limited literature regarding the impact that occupational deprivation has on individuals experiencing homelessness. The purpose of this scoping review is to understand the evidence supporting occupational therapy's role in reducing occupational deprivation for the rural homeless population as they transition into housing. Homeless individuals experience various barriers that inhibit their occupational performance and transition into housing. However, little is known about the occupational barriers experienced by rural homeless population. The objective of this scoping review is to understand the evidence supporting occupational therapy's role in reducing occupational deprivation for the rural homeless population as they transition into housing. The PRISMA SCR method was used as a guide during the scoping review process. A scoping review was conducted to investigate the lack of literature regarding occupational accessibility of the rural homeless population. Study procedures involved the literature research utilizing Sentinel database. Search limits and inclusion criteria consisted of peer-reviewed and full-text articles written in the English language. Further search limits were applied to retract historical articles within the literature review between the years of January 2016 and January 2021. Additional articles were included to provide current evidence regarding occupational therapy in rural homelessness. Inclusion criteria were also comprised of literature that addressed the homeless population and primarily focused on occupational therapy and deprivation. Articles were excluded that concentrated solely on the medical needs of the homeless individuals and articles that addressed the process of becoming homeless. Of the original 412 articles, 45 were obtained for full text review, and 12 articles were ultimately included in the scoping review.
Regarding the findings of our study, 3 themes were identified: occupational deprivation, transition into housing, and occupational therapy's role in homelessness. Individuals experiencing homelessness often face a disruption in occupational balance secondary to physical and social displacement, ultimately impacting personal roles and daily activities. Prolonged disruption of occupational balance can lead to occupational deprivation due to a lack of opportunities to engage in meaningful activities. The National Alliance to End Homelessness stated that the solution to homelessness is housing. However, the complex issues of transitioning out of homelessness are attributed to the lack of simplistic and accessible housing programs, lack of research identifying the connection between occupations and the transition process, and lack of advocacy and support to overcome transitional barriers. Occupational therapy services can provide a conducive environment, enrich occupational repertoire, and advocate for community resources, designing initiatives that promote the use of occupation in the transitioning to permanent housing, and promote lifestyle necessary for transitioning out of homelessness. Individuals experiencing homelessness are often associated with an acculturation process in which homelessness is perceived as normal, consequently resulting in homeless individuals having little control of their time or the occupations and activities in which they want to engage due to factors outside of their control, resulting in diminished personal identity and overall quality of life, thus leading to occupational deprivation. The scoping review found that the majority of homeless studies focus on urban areas with less emphasis on the rural homeless population, thus posing as a weakness to the findings. However, the same structural factors that contribute to the urban homelessness also leads to rural homelessness, such as addiction, mental illness, and/or disability, thus demonstrating that occupational deprivation, lack of resources promoting transition into housing, and limited access to medical care, such as occupational therapy, also impact rural areas. Consequently, these results demonstrate that the lack of occupational resources impacts rural homeless individuals transitioning into housing. The purpose of the scoping review was to provide a synopsis regarding occupational therapy's role in reducing occupational deprivation for the rural homeless population as they transition into housing. The scoping review found that the literature did not adequately take into account the unique challenges of homelessness in rural settings. However, the results indicated that homeless individuals have similar barriers and experiences regardless of the demographic location in which they reside. Lastly, occupational therapy practitioners' expertise in addressing occupational deprivation and participation enable them to be at the forefront of research to address the gap in literature regarding the influence of occupational resources and rural homeless transitioning.